Welcome to our series of healthcare scene interviews where we sit down with top leaders in healthcare IT. I'm John Lynn, the founder of healthcarescene.com, a network of leading healthcare IT resources. And I'm happy to host the king of workflow here with me today. We're going to be talking to healthcare IT workflow, EHR workflow, and in particular, what's happening at HIMSS 16 with vendors. Oh, he even has the badge, Workflow King. Perfect. Well, before I introduce our guest today, I want to offer a few logistical reminders. We'll talk for a few minutes at the beginning, but because Chuck is the blabaholic in the room, we want to incorporate as many people as possible. So feel free. There's two open seats, and we'll just rotate people through. One at a time. Have people hop on, hop off during the discussion. So feel free to do that. Just click the call in and we'll definitely add you. Do it at any time. You're certainly welcome to join. Second is if you like what someone's saying or if you just like the person, click on their face, give them props. Also on the left side is a tweet button and a share on Facebook. If you want to do those, we appreciate that very much. I know there's a few people that probably don't want to hop on video. There's a few shy people, which I don't know why they would be shy, but if you're too shy to hop on camera, feel free to ask any questions also in the chat. If you do /Q and then a space, you can put your questions, it will queue it up, and we'll do our best to answer those questions as well. So we'll go for about an hour, and like I said, all of you are welcome to join. I know there's a number of people who have joined specifically to talk about what they're doing related to workflow. But before we do that, let's welcome our special guest, the king of workflow, Dr. Charles Webster, more affectionately known as Chuck or @Wareflow on Twitter. Welcome, Chuck.
Glad to be here. Thank you for having me. I'm willing to talk about workflow a lot. So, and you're a bully pulpit. You've got a great series going here on Blab.
Thanks. Well, we couldn't have Chuck on without talking workflow. So I think you've branded yourself for good, bad, or otherwise.
It's literally impossible to have me on. But I think you have noticed that when the topic isn't about workflow, I don't try to monopolize unnecessarily the conversation.
That's true. You are good on Blab, even non-workflow topics. That's true. So Chuck, tell us, how did you get into workflow? Like, why are you addicted to workflow? Maybe that, I'm not your counselor or psychologist, but what's your story? Why workflow?
Well, partly it's educational. I was a pre-med accounting major, which is pretty darn unusual. And I was, so I had to take all these really tough accounting courses and really tough pre-med courses. And I basically analyzed, in The Martian, the movie where he said, I'm going to have to science the heck out of this. I had to workflow the heck out of my life in order to do well enough in order to, get into medical school and, do the accounting degree. And then I got to industrial engineering, and industrial engineering is all about workflow. So I have a master's in industrial engineering. And if you look at the intersection of all those, I remember people going, why, what a stupid thing to do, combine an accounting degree and a medical degree. Well, guess what? Today, people think it's brilliant because healthcare costs are such a big issue. So that's sort of my roots in workflow. It has to do with cost and sort of life hacks, managing my own life in a situation where I needed to pull out all the plugs, so to speak.
I think you're the only one in healthcare that might have a medical degree, an industrial engineering degree. That's quite the combination.
Actually, there's a couple of people who have MDs and industrial engineering degrees. I've never met anybody who has an accounting degree and a medical degree.
Yeah. Well, most of the industrial engineers don't have a medical degree as well, so that's interesting. Well, yeah, when we talked about doing this Blab, the reason I was really interested in doing it is that I know that each year you go to HIMSS, you go through the vendor list and evaluate, how are they using workflow? How are they using workflow technologies? How are they working on that? And so I love when you have a depth of history about something. And so I'm interested to know, how has workflow technologies evolved at HIMSS? When did you start kind of tracking it? Was it, I think, 2011? Was that the first year? Or
2010 was the first year I started to systematically sort of mine the websites of all the exhibitors. My first HIMSS was in 1995, and I presented on workflow management systems at the point of care. And I just noticed there just was a dearth of knowledge and content in that area. In 2010, when I started to sort of tweet and blog more systematically, I said, I know what I'll do. I'll look at all the websites and find all the really great workflow stories and hopefully workflow technology stories. And I basically found zip. I mean, it was just amazing. There was hardly any mention of even the phrase workflow anywhere on any website.
Which 2010 was right as meaningful use was starting, right? I guess the next year.
Well, the thing is workflow is it's on everybody's mind now, but people forget that we're very data centric. It's all about data. It's all about getting meaningful use certified. And as soon as you start talking about workflows, you get into usability, and of course, there's been a kind of a pushback from doctors in terms of the usability of these systems. So so to some extent, the emphasis on workflow now is a kind of a backlash. But that's okay. I'm willing to. There's also a lot of great workflow stuff going on now. In 2011, I found about 2% of websites had sort of interesting stories that I could tweet about, and then it went 4%. 8%, 16%, and I remember thinking going into 2015, and I literally go to every single website of 12 to 13 to 1,400 websites. It takes a couple of weeks. And I remember thinking, well, there's no way that it's going to double again, because it just can't. I mean, it has to stop at some point. 2, 4, 8, 16. And I basically ran out of time. There was so many people who were saying, well, we improve workflow in this way, or here's our workflow testimony, or here's our workflow engine, or we're leveraging new cool technology from the workflow technology industry, which is called business process management. And I ran out of time. I actually was 100 vendors short. And so this year I've used a different system. I'm still searching all of the websites. And so in fact, I've got about 107. My cutoff was January 14th. There were about 1,000 vendors registered. A couple hundred have been added since. I'm hoping to circle back and get them before the HIMSS shows up. But basically to give you the short answer, in the last couple of years, there's just been a tremendous surge. Now, between a third and a half of all HIMSS exhibitor websites have some kind of workflow angle. They talk about workflow, how they alleviate workflow problems, how they create great workflow, or how it fits seamlessly into someone's workflow. And that's, so given that 1995 is when I kind of started, evangelizing for this stuff, and obsessively perhaps, now I'm kind of, extremely excited to see this sort of dramatic hockey stick kind of uptick in interest in workflow, and also great products that just have great workflow and that are designed to create efficient, effective, and satisfying workflows.
Mm-hmm. So can you give us some examples? Like what are some of the things that you'll look for on a website, and, examples of what you'd found, as far as how they're applying it? Because I think, a lot of people can define workflow in a lot of different ways, right? So what are some examples of things you look for? What are the common threads that you see on these websites? I mean, it's incredible to think you visited each one, right?
Yeah. First of all, I've looked at hundreds of definitions of workflow, and mine is relatively simple. It's simply a series of steps or tasks, consuming resources, achieving goals. Now, those steps could be activities, or they could be experiences. So there's an incredibly important relationship between workflow and patient experience, because you think about a series of experiences that are being driven by the IT. And so I guess, some of the areas I'm really kind of excited about is in structured messaging, for example. There's this wonderful phrase. My wife has worked in the luxury hotel industry for years. And there's this phrase, the system behind the smiles. And basically all of those, half of customer experience is based on your interaction with that frontline staff. But half of that experience is based on things that frontline staff have no control over. It's the back end systems that have to work. That's the workflow that has to work. And structured messaging is an example of clinicians communicating and no tasks languishing. And even though the patient isn't interacting with the structured messaging system, their customer experience or patient experience is benefited. Another area is in real-time location services. Folks are adding workflow engines to all the sensory data. So if you think about the Internet of Things and wearable data, you have all this timestamp location data, and it's tracking not just where devices are, where dollies are, but it's also tracking patient state, and which brings me to kind of the and there's about a dozen other areas in which workflow technology is making its push, such as speech recognition uses sophisticated workflow technology on the back end to turn sounds into database entries and to route that to the right person and do quality assurance. Anyway, the four things that I look for are...
Before you get to that, Versus Tech made a good comment that said, yes, RTLS, the real-time location systems, is a powerful workflow driver. I think we're just beginning that journey, right? I mean, we still kind of need to install the hardware. We need to think about what's the right way to do it. So I think that's interesting. It's such a powerful technology, but we're still, we just landed on the moon, and now we're trying to figure out what to do with it, right?
No, I've been tweeting about the potential interaction between real-time location tracking services and workflow engines for 4 or 5 years. And within the last couple of years, I'm seeing really interesting amalgams or mashups of the RTLS and the workflow technology, so that in real time, where the bottleneck is, where the change in demand is, and you can in real time send notifications to staff to do kind of basically load leveling. And the other thing is if you combine the RTLS and workflow technology, you're seeing dramatic reductions in what industrial engineers call cycle time. Cycle time is the beginning to the end of a workflow. So the beginning to the end of a patient encounter in an ambulatory office, or the beginning to the end of a hospital stay, or the beginning to the end of a check-in or a discharge process. And so I'm seeing folks that workflows that require 4 hours to discharge someone being dropped to half an hour, combining real-time LS and workflow technology.
Yeah, I saw this firsthand at Sanford Health in Fargo, North Dakota. They built this new clinic, and they just totally applied whatever technology they could find, that made sense. And they actually created kind of a Disney front of house, back of house, which is its own unique experience. But they incorporated all this monitoring, so the patient would actually room themselves. And then as soon as the patient walked in, it would realize that the patient entered the room, and it would notify the nurse that they were there. And I forget exactly what their goal was, but it was something like within a minute of the patient rooming themselves, the nurse would walk in and say, hey, welcome for the visit, and then start it. And it tracked everything. So they would know when the nurse went in, it would know when the doctor went in. I mean, it was just the most interesting and beautiful workflow. You could see it was the baseline of what was going to be possible. I'm sure some of the doctors and nurses were a little reticent at the beginning to say, do I want to be tracked like that? And the patients, do I want to be tracked? But, it was a powerful workflow solution, I thought.
Well, there's another example like that is around perioperative workflows. This company set up a dashboard that shows exactly where you are in the surgical workflow, whether and there was a bit of data they needed to get that they couldn't get from sensing, or decided not to use that, and they ended up putting a big red button on the wall in the door at the swinging doors into the surgical suite, and they basically just told everybody, okay, when you walk by there with a patient, just punch that button. And there was some resistance to that, as you mentioned, feeling tracked like that. But then other people were looking on the dashboard, and they were looking for that information, and the other users in the workflow were going back and saying, hey, darn it, punch that button, because we need to know that information.
You didn't do it.
For life easier. So that's another good example.
That's great. Yeah, I mean, I actually just did my last lab, I think, was with SAP, and they're working the peri-ops stuff at Mercy and how they used analytics to improve it, right? Which, that all goes back to what's the workflow to get the data so you can improve the services.
Yeah,
Medicasoft LLC said it's very beneficial when tracking flow through emergency departments to either discharge or hospital admission. I mean, the nice thing is the EDs want to get the workflow right because they know how important that is.
And I'd like to mention, you mentioned SAP and you mentioned Medicasoft, so I really, want to highlight those folks at HIMSS that have interesting workflow angles. And SAP uses a very advanced form of workflow called business process management. You'll sometimes see BPM or the hashtag BPM. And 20 years ago it was called the workflow management systems industry. Now it's called the BPM industry. And there are a lot of BPM companies now at HIMSS. And Medicasoft has a really interesting blog post about which they talk about workflow engines and managing tasks in exactly, you've heard me talk about task management, workflow management, workflow engines now for 4 or 5 years. And they have a blog post that I tweeted out, and I said, this is just such an excellent introduction to the potential use of workflow engines at the point of care. And that's an area that healthcare really hasn't taken advantage of as much yet as I think we will see in the next couple of years.
Interesting. And, on that note, I just want to remind people, we're happy to add anyone on if Versus Tech or Medicasoft wants to hop on. I see Max is here. She said she's shy, but I'm sure she'd hop on. Joe, if you want to hop on, feel free to hop on. There's a number of other people that have joined. So I see FormFast is here. If any of you guys want to hop on now. We're happy to talk with you about your products and workflow. Otherwise, Chuck and I have no problem talking.
FormFast, fantastic. And I think Max Stroud is fantastic. I'm blocking on the vendor that Max is. She'll introduce herself.
Hi, I'm Max Stroud. I'm a lead consultant with Galen Healthcare.
Galen Health, yes. And I've often tweeted about you guys in workflow over the last couple of years.
Yeah, I'm kind of interested, Chuck, in kind of how you see workflow technology helping at the clinic level, because I think a lot of things that we get into, we're seeing, speed is emphasized so much over quality, and we see places where providers are clicking through task lists and work lists to get them done because the goal is to get it done. And, where's that intersection of getting the right workflow, but also getting the quality care,
right,
and not just focusing on efficiency?
You broke up there a little bit at the beginning, but I think I get the gist of your question. One of the great things about workflow technology is that the workflow engine can consult models of workflow. Sometimes they're called process maps. And it can present the right screen to the right person at the right time. And right now, most EHRs don't have that technology. Therefore, the user has to search around. It used to be you had to click down these menus, and now you have lots of tabs and clicking. And if the system has a better understanding of the workflows, it can present the right screen at the right time. And that transforms the experience in this way. If you've ever installed software and just gone next, 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 you're always hitting the same thing in the same spot where you expect it. It dramatically speeds up installing software and dramatically reduces the complexity and cognitive load and all of that. And so so I think that you can achieve much of. I don't believe that doctors are really that against data entry. If the data is going to benefit the patient, they're going to help them make a decision in the future, or if they're making an order, they're ordering something to happen, assemble a vaccination tray and vaccinize this child, they're okay with it. Most of the clicking in current electronic health records is the navigation, going to try to find the screen and scroll to find the place where you enter the data. And that navigation is exactly the what a good workflow engine can bring to the party. Automatic navigation.
So I guess, Chuck, are you saying that just because you're focusing on efficiency doesn't mean you have a reduction of quality? In fact, I think that's my experience, is that when you implement the right workflow, it makes you more efficient and can improve your quality, right? Which I think is Max's question, right?
Well, yeah, and you're right. So let's imagine that you have a workflow that's 8 steps. And it starts over here, goes over to here. And then you eliminate the steps that aren't value added, that aren't purposeful. And a lot of those steps are navigating in the application. So if you can, let's say, eliminate 4 of those steps, you can now execute that workflow twice in the same amount of time using the same amount of resources. Now you've basically doubled what's called throughput by reducing cycle time. But here's the thing. When you shorten a workflow, you not only create double your productivity, that workflow invariably becomes more consistent, and also think about the opportunity cost it becomes more predictable. And that means that patients don't have to wait as long, because if you know exactly when the workflow is going to start, because you know when the other workflows are going to end, that means that the patient doesn't have to wait as long. Second of all, they're not tied up in the workflow as long. When you think about the opportunity cost. So there's all these things that patients would rather be doing than waiting for the workflow to start or actually being in the workflow. And so by dramatically making the workflow more efficient and shortening it and getting rid of those steps, you can dramatically improve, because the number one thing that, patients usually complain about is having to wait. And so it's incredibly important to patient experience.
Well, one of the things you mentioned earlier, Charles, this is Sandy Geary, by the way, with Microsoft. So I'm a clinical informaticist that works with our clinical team. So we have a team of clinicians that work directly with us. And one of the things we're currently working on that's really interesting with workflow is how they go from working with multi-patients. So, a lot of times they'll have multiple patients on their ward or ED. And again, they're trying to, as you mentioned earlier, minimize that time through the flow of the department and the whole process. And how do we make the software so it goes from that multiple patient boards and tracking flows to single patient encounters? And how can we help us with that to smooth that out? So a lot, because it's very interruption driven, as we're working with different situations.
John asked about what I look for, and there's 4 things that I look for right now, and that is and I can't go into all of them, but automaticity, transparency, flexibility, and improvability are the 4 major sort of workflow properties that I look at in terms of what a technology brings to improving workflow. And transparency, that is being able to see in a single view the state of all the tasks, of all the workflows, the state of all. It's just kind of like what aircraft control towers do. Aircraft control towers they see all the planes. They know how much fuel, how long they've been waiting. They know what order. And so yes, so the pilots and the patients are safer. They land more quickly. But what you're talking about is a kind of a big logistical picture, and the kind of the traffic management and transparency, being able to track all that stuff, which kind of brings you back a little bit to the RTLS stuff. But there's other ways of getting that information, because you can infer it from clicks. When you're involved in a particular activity, that, well, if there's, if you're doing the physical exam, even though you're not literally physically tracking the patient, they're in a physical exam. So there is a kind of a way to leverage both of those.
Interesting. So Versus asked an interesting question. They said, how about automated data entry? They've just done an implementation that automates entering the case start and case stop times in Epic Optime. What is the balance between automation of all the data entry and workflow? What's your approach with that, Chuck?
Well, I'm assuming this is kind of the question of, well, if we can automate the data coming, for example, from medical devices into the EHR and not require a human to enter that themselves, then we've saved someone some labor and also potential for misentry. And also, when I've seen systems now that are verging on ambient listening, so the doctor is just talking to the patient, and in the background, and it's just like the old days, and this is being recorded, and then they have scribes that are remote, and that's actually I believe how Augmetics is still involved in the Google Glass work program, although it's probably going to be rebranded. Doing away with the phrase Google Glass, but the idea is that there it's not automated data entry in the sense that it's pure software, but rather what you're doing is you're offloading the expense of data entry from the highly expensive physician to the less expensive scribe. But you're using technology to do that. Those systems, the medical scribe systems, also often use sophisticated workflow management. In fact, what scribes do is way more than simply enter data. What they also do is a lot of intelligent task management. And so one of the things that the medical scribe companies are doing is creating workflow management systems that are almost in a kind of a cognitive symbiosis with the medical scribes. And that there's a great deal of value to that for such things as care coordination and coordinating across the continuum of care, having that human in the loop in that manner.
A lot of issues, but Max, I mean, as a consultant, you've probably seen a lot of different workflow technologies, and we'd love to hear more from Medicasoft. What's your experience with workflow?
I think for me, it's not as much the experience with technology pieces of it, but more really often the disconnect between how the software was designed and what's actually happening in clinics and how people actually work and what they really, kind of what they need the software to do compared to what the software was designed to do. And that's kind of where we come in a lot of times and kind of say, well, we can, let's mold the software to do what you need it to do or switch it around to make it more efficient. And some of our optimization projects, we're looking at how long is it taking doctors to sign notes and why, and how many tasks are needlessly generated when you have something already documented in the system somewhere else. And so a lot of that is something that it feels like we really need to pick apart at a human level sometimes because of, things are done with implementation and training, and then they're gone and you just have the help desk, and people change the way they do things over time. And so kind of, one of the things that I've been thinking about a lot lately is kind of how do we almost take a quality approach to a tier 2 support and maintain a connection with the clinics and ongoing training and making sure that people understand the software is there to work for them. We want to make their lives easier, not harder. And we want to make the data available to accentuate patient care. So,
John, you can attest to the fact I've talked about customizable workflow for years, and that is people say we need to involve clinicians in the design of the EHR or whatever system before we implement it. Well, guess what? That system needs to be customizable in ways after it is implemented, so that because the programmers don't know the workflows, and that's one of the benefits of workflow technology is that you can change the workflows and you can customize that interaction without having to send it back and getting a Java or C# or a month programmer to write some code and a pilot or whatever, and then you have to train people. And that's one of the values of workflow technology is that it can be customized after it's implemented to increase usability. And that was improvability in that list of 4 that I mentioned.
That's definitely some of the things that we've seen, is to be able to customize it when you actually know what the workflow at the facility is. And there's the addition of what you see on the screen and the timing of it, but also the fact that clinicians want to be able to enter that data in the context of which they're doing the actions, while they're in the process and in their thought process, their cognitive process, rather than having to try to document it or do it later. So you can work that cognitive processing and why they're making the decisions, and being able to record why they're making those decisions at the point they do it, versus like some of the older type EHRs where it's very structured and all that documentation has to be done afterwards, or it drives your workflow. So those are the type of things
I have what I call the litmus test for frozen EHR workflow. The litmus test is that you put that little eyedropper and you drop something into the beaker in the chemical lab, and it goes from red to blue, and it tells you exactly the acidity level. Litmus test. And of course, litmus test is just very metaphorically. Litmus test is kind of like a single check box. You say, well, you got to pass this test. And that is when you were looking at the workflow of an electronic health record or some other health IT system that clinicians are going to be using, say, okay, show me a demo, and they show you, a sequence of screens and behavior. Then you say, okay, now I want you to change the workflow. I want you to change I want you to show me the workflow editor, or I want you to show me the screen that allows you so that I want you to, there's this one step that we don't do in our clinic. Let's get rid of that step. Now, if they say, oh, well, I'm sorry, we can't do that, we have to go back to the programmers. Well, guess what? There's no workflow engine. The workflow isn't customizable. But if they say, oh, no problem, and they can fix it on the spot, there's a good bet that is based on workflow technology.
Right. And then you need to provide the tools that allow people to do that so they can easily see that and understand it as well. So it's not kind of hidden in some kind of foreign language, but it's actually something that a front-end user can understand and see and be able to modify.
It's interesting because I think that's one of the biggest weaknesses I've seen in a lot of the healthcare IT implementations. You hear all these people complaining that it's so awful, but they haven't invested the time it takes to customize the workflow or customize the software to meet their needs. I'm sure Max, when they're consulting, knows all about that because they're probably at the breaking point when they finally come to you and say, I need to fix this workflow. So it's like, okay, they're happy to fork over a check for a bunch of money, but if you say, hey, spend a couple hours figuring out your workflow, most of them will be like, no, that seems a bit, too much. So it's an interesting balance, and no doubt consultants will have a long life in healthcare to come.
The other part that's interesting with that is also the maintenance of the workflow, because you don't want it to be overwhelming. Because it does change all the time, and so it needs to be something that's easy to change. Because if it's cumbersome to make those changes or maintain it, that's a problem as well.
Yeah. And having a process where you actually review it regularly. There's a post coming out on hospital EMR and EHR by this. It's a new series we're doing called the Healthcare Optimization Scene. So how do you optimize your EMR, your ERP? And he made some interesting points about, the go live date, people feel like that's like the end of the project, when in reality it's the middle of the project, right? And you might even make an argument it's before that, but it's somewhere in the middle, right? And that, all of the optimization of your workflow and of your processes is what what you have to do after the fact to get value out of the software. So it looks like there's a number of other people that may want to hop on. I don't know if Max or Medicasoft, you want to switch out, but we can certainly rotate people through. For example, let's see, there's a few questions too. So Cal Rye said, what's your take on the role of AI in streaming workflows? Any thoughts on AI and workflow, Chuck?
I need to know a bit more about what he means by streaming workflows. Actually, my master's is in artificial intelligence. I didn't mention I've got 4 degrees, in my mind, the connection is, and here Cal Rye is coming on. Do folks remember expert systems? Expert systems. You could put a bunch of rules in it, and then they would do infectious disease diagnosis. And so the way you customize the expertise of the expert system is by changing the rules. That's exactly the same way that workflow systems work. And workflow systems, the rules are about workflow instead of about clinical diagnosis. 2 areas where you're seeing, someone mentioned Watson here, and by the way, I went to school with the scientist behind Watson. IBM Watson, and Watson takes that data that is the question, it breaks it apart, it combines it with a bunch of data sources, and then generates a reply through a series of steps, also leveraging workflow technology. It's based on an open source workflow management system, which the name escapes me right now. And then finally, to get back to Cal Rye's point, ask about streaming, what I'm reminded of is Google Now. So Google Now tries to, if anybody's on Android, and you have that turned on, it tries to predict what you're going to do next and then do something useful. And so folks are using machine learning in order to actually learn, using deep learning. You've probably heard of that. They're trying to learn the workflows and then use that learning in order to do something useful. Just like earlier I was talking about users needing to be able to customize their workflow so that the electronic health record did the right thing at the right time. Google is working on machine learning technology that makes your smartphone do the right thing at the right time. In one case, a human is editing the workflow, and in the other case, it's being learned through deep learning and machine learning.
Yeah, I think it's an interesting question. IBM Watson could certainly help with the workflow and business process management, but it's so immature right now. So it'll be interesting to see how that evolves over time. And that's true for all the AI technologies that are out there.
Here's an interesting question from M. Sharmas, a great guy who archies me. Thank you very much. How can we make workflow a good-to-have feature to go to a must-have feature? Does it need a meaningful use post? I push. I do not think so. I will give you an interesting angle on meaningful use in workflow and workflow technology. In 2000, I was the lead on the project for our electronic health record to become CCHIT certified in 2006. So we were amongst the first of 18. And in 2004, the planning started. In the early list of requirements to get CCHIT certified included workflow engines, customizable workflow, transparent workflow, and then it got eliminated for some reason. I have mixed feelings about that because I have mixed feelings about meaningful use, which kind of evolved out of, it competed for and replaced CCHIT. Now, I will tell you this, and that is at one of the recent federal health IT panel briefings and discussions, they actually discussed adding workflow engine as a meaningful use requirement. Okay. The problem is, I think they screw it up. I'd rather the market determine whether you buy a system with a workflow engine or not. And then if there are multiple systems and they use different workflow engines and they work in different ways, I would like the market to pick and choose the users. I don't want to see meaningful use do the same thing to workflow that it already did to
yeah, and there's a huge risk in that. I mean, when I wrote about meaningful use being replaced or whatever I said, it could get worse, right? So be careful what you wish for. I think going back to that question, though, is, should the government need to stimulate workflow technologies? My answer is no. One, because how would they even define workflow technology? This is such an impossible task. And two, if the technologies are that good, they should be good on their own, and they should provide the efficiencies that you need. And if they provide those efficiencies, then vendors should want to implement them. So it shouldn't take a government incentive to actually want to improve your software technology. In fact, I'm excited for the period of non-meaningful use where software vendors are actually catering to the customers and implementing technologies, including workflow technologies, that just benefit the patient and benefit the doctor.
I want to here. I see working on SRS stuff, and in fact, I believe SRS started out using a workflow engine on a document imaging platform, and that would have been 10, 15 years ago. Now, I know that you've mentioned that they're introducing a new workflow engine. And so, so I'm seeing workflow engines sprouting like mushrooms in the spring at HIMSS, and that's a fantastic thing.
Yeah.
John?
Yeah, so I think we can actually hear Cal. Cal, are you there?
Can you hear me?
Yeah, so we can't see you, but we can hear you. So good enough. I mean, no one wants to see our pretty faces anyways, so.
But you guys look awesome to me.
We'll pay you later. We'll pay you at HIMSS. But yeah, Cal, so you're from SRS Soft. So tell us about what you guys have been doing with workflow.
To set the context, we are in a specialty ambulatory high volume, high transaction space. So that's kind of what we focus on. And one of the things we've been talking to our customers about and the market about is, how do we change the dialogue on workflow? We've been, like, for the past 10 years, we've been trying to automate and digitize workflow that started on paper, and now it's in digital. And now what we're saying is, what can you do in an electronic environment, in a digital environment, that you couldn't otherwise have done when you started in paper? And one of the things what we're doing now, and this is something that we're doing gradually, we're actually working on something called smart workflow. Essentially what it is we know who the people are who's using the software. We know the role that we're dealing with, and we know what kind of patient they see. And what we're trying to do is seed the system with certain protocols. So let's say you're seeing, I don't know, you're someone who does hip replacement. Okay, so we set up the protocol and say, here's what you typically do when you do hip. But guess what? If you see a patient that is in certain demographic, maybe they have diabetes, maybe they have some other conditions, you tend to change your workflow as you do that, and the system adapt to you. So we come back and say, hey, listen, every time you do HIP, you do that, except when you see these conditions. Should that be a workflow that the system should adapt to you? And by doing that, we're essentially taking waste out of the system and really streamlining the way. That was kind of the question we had. It's not necessarily streaming, but streamlining the way you run patient through the system by moving the provider upstream in the equation. So you're documenting as you go rather than go through the process of seeing a patient, doing some clicks, doing some collection, and then going and finishing up the encounter. So that's really the philosophy, is to get to a state where we're predicting the next step or two and adapting the workflow based on the patient you see and the role you play in the encounter.
Are you pushing that down the stack as well to the nurses? I mean, I've heard a lot of people doing that, right, where they have these nursing staff which can facilitate the doctor in a much better way. You know, it sounds like your technology would work well with nurses if you predict what the doctor is going to choose, so the nurses can prep those things before the doctor even arrives. Are you doing that direction as well?
You got it, John. I think what we do, so that's what I mean by role-based. So essentially what we do, not only we're able to do that, mainly push it downstream to the nurse or the MA, but as the different roles come in out of the equation, you almost have like a counter or like a summary on your right hand, on your side of the screen that's telling you what happened around you. So if you come in at it from a nurse perspective, you're able to see what the front desk person has already done. Or if you come in from a provider perspective, it tells you what other roles have done with the encounter, and it predicts kind of what you should do next based on that equation. So it's all about what we do is we use services in the cloud on machine learning, where we actually seed the system with some assumptions, and the system evolves and learns from it as you use it. It's pretty fascinating. It's very early in the process. We have some really brave souls are working with us, but it's just gonna change the way we do medicine.
I gotta brag. At HIMSS 16 years ago, I gave the first presentation on an electronic health record built on a workflow management system. And there's the link right there. There's the link that describes it. And everything Cal was talking about, exactly. Task, tracking the task, work plans, a dashboard, an office view that you will see all of this task status at the same time. That technology, not applied to healthcare, has been widely prevalent in other industries for over 2 decades. And it's only now beginning to fuse into healthcare. I'm just so delighted. And I think there's a kind of almost a pent-up deluge happening. That is health IT and medical informatics. About 20 years ago, they came to a fork in the road and they said, data is complicated and workflow is complicated. We can't tackle both, so we're going to tackle data. And a lot of what has happened in the last 2 decades has become from this extremely, data is really, really important. They're trying to collect all this data, but really workflow is more important. You need to figure out what your goals are, figure out what the steps in the workflow are, and then figure out the data to feed that. And if all what you're doing is collecting a bunch of data, now you have to reverse engineer the system in order to add that workflow layer.
You got it.
I remember some early discussions with Evan Still, the former CEO of SRS Soft, and him kind of complaining. He said, "Yeah, we'll do meaningful use because we know we have to as an EHR vendor." But you could tell it was against the principles of what he wanted to accomplish. So it's interesting that now meaningful use has matured to a point that SRS Soft can do these. I think you call them smart workflows, right, Kel?
Yeah, you got it. And you know what? I think now that we're doing meaningful use and we're collecting data, and I think the fact that we're able to exchange data in a somewhat standard way, although we're not 100% standard, I think that's going to elevate the discussion to having the ability to run these workflows and workflow engines that Chuck are talking about outside of your ecosystem. You don't have to be inherently having a workflow engine that's built on Epic or Cerner or anybody else. You can run workflows agnostic to the data set.
Exactly. 6 months ago, I wrote a 7,000-word, 5-part series in healthcare IT news called Achieving Task and Workflow Interoperability in Healthcare. And it's all about how we are laying down a layer of process-aware workflow engine, coordinated care in the cloud on top of all of these database-like electronic health records. And so absolutely, that's exactly what's going to happen.
Welcome, FormFast. What's your name? What do you do at FormFast?
My name is Aaron Vald. I'm the Director of Marketing here.
Excellent. Well, welcome to the conversation. Anything you want to add? Any questions you want to offer? That's the floor is yours.
I just wanted to comment that what we see a huge potential for workflow across the entire healthcare enterprise, not just on the clinical side, but on the administrative side as well. We offer solutions for HR, risk management, purchasing, and seeing increased adoption for those solutions as hospitals are looking for greater efficiency across the entire enterprise, really. So we're really excited about the potential for workflow to transform healthcare.
I did a webinar with you guys about 4 years ago, called The Power of Process, in which it's 45 minutes long. It's on YouTube. I'll post it in a moment. But everything he talked about, because not just the clinical workflows have a tremendous impact on patient experience. These administrative workflows happen in the background. If staff can't count on them working perfectly, then the staff is going to be mad, and they're not going to be able to do what they need to do, and there's all going to be all kinds of workarounds. And so the kind of stuff that FormFast does at the enterprise level for administrative workflows is absolutely critical for patient experience.
Absolutely. And we're finding as well that the way that the technology helps users adopt those workflows, the workflow technology to improve their processes. We're finding that with our eForms capabilities, we're mostly known as the leader in eForms. That's a great way to start collecting data that can drive workflow with our workflow engine. It's a familiar interface that users can use to start to improve processes.
Excellent. There's a number of people that are online. There's an open seat if you want to join. I see Michelle from Connect. I see Mox Evans here. Experian just hopped on. There's an extra seat if you want to hop on, ask any questions, or Max or FormFast or FormFast is on Versus Tech. Feel free to hop on. So how have you seen the evolution of your technology though, right? I mean, because you really did start as the paper world with the forms. Where are you seeing all of your technology going in the future?
Well, the evolution for us was starting off with forms automation, that we're moving documents around, printing them, imprinting them with patient information. Our customers came to us and wanted to see if we could also automate those administrative processes with workflows. So we developed a workflow engine. We developed tools to make it easy for them to design their workflow. We have a visual workflow designer, drag and drop, so that you can visualize what the workflow process is. Much like what Chuck was talking about before, if you can visualize it, you can understand it, it's going to be easier to see where the process can be improved. So for us, it's about finding new ways to make it easier to design the workflow, to automate the process, and provide data that hospital leaders are looking for.
I love this. This is such an incredible. I love everything everybody said about workflow. Thank you, John, for provoking this blab on this subject at this time.
Definitely. Well, I mean, it's interesting, like you said, to see the explosion of it. I think it's interesting, FormFast perspective, saying, okay, well, let's do more than the clinical. And I've heard that more and more from vendors. They're like, okay, well, it's nice to do the clinical, it's nice to do the reimbursement, but there's a whole lot more to running a healthcare organization than just that. And sometimes I think the CIOs of healthcare organizations and then doctors, practice managers in the smaller practices sometimes forget that technology can benefit them in more than just an EHR, a PM, and an HIS system. So interesting. Yeah,
we're definitely seeing that. And of course, I'd be remiss if I didn't plug our presence at HIMSS, being in marketing. So we encourage everyone to stop by our booth at 4849 and have a conversation with us about what your challenges are, where you'd like to see your processes automated, and let us fill you in on how we can help you.
That's true. I think I think everyone's going to be at HIMSS, right? It seems like. So that's great. I think Chuck will be covering the workflow solutions, and he's got his hat on, so he's going to be doing 1-minute hack cams. I don't know if that's all workflow focused. Are you going to go to each one and say, "Show me your workflow in 1 minute"?
I'm looking hack cam. So this is what he's talking about is every year for the last 4 or 5 years, I use a different camera and I actually clip it to my visor, and I walk around and I do 1-minute interviews. I ask you one question, it's whatever question you want, and I usually try to find the workflow people. The only problem is when I'm walking along, people run up after me and they beg me to participate, and then I have to ask them a question that isn't about workflow. So I'll take off my hat sometimes to avoid that. But there was a question. Medicasoft asked about workflow analytics. Was that kind of?
That was interesting. One of the things we see is the ability to collect analytics and data as you're doing the workflows and the timing in that. And just wondered how much you run into that. How many products you see processing those type of things to improve processes.
Looks like we lost Chuck. So.
Lost the person answer my question.
My browser.
Yeah, well, when you ask hard questions, he like dips out. That's just what happens.
Well, okay, we've got 7 minutes left here. I'll just take 2 of them, and I'll answer what I think the question is. And yes, I am seeing workflow. I'm seeing timestamp data,
right.
Not just the timestamp data in the electronic health record, but also coming off the interaction between the Internet of Things and wearable devices in order to reconstruct entire process maps. In fact, last February, I gave the keynote at the System for Health, the Society for Health Systems, Healthcare Systems Process Improvement Conference in Orlando, and it was exactly about this idea of taking this time, and it's called process mining. And process mining used to be called workflow mining. You can take 1 million data points, and all you need to do is an ID for the workflow. So the workflow would be a patient enters and then they leaves. A hospital or a clinic or whatever, and then you have a series of tasks. And the tasks might be check the medications or take them to surgery, and then you need a timestamp. You need a time and a date. Those 3 things, okay? And then you can add other information like what the diagnosis is, demographic information, allow you to slice and dice. You run that through a process mining system, and you get these beautiful flowcharts that show you the bottlenecks and the rework. It's so I've got. In fact, I'll put a link in here at 2012. But most of that is happening now, kind of in the medical informatics research world. If you go to MedInfo, AMIA, American Medical Informatics Association, the last couple of years you're starting to see that. Although I did it first in 2012, based on internal projects in 2008. But it's coming into the health IT HIMSS side, and that's one of the areas that I'm going to be looking for this year at HIMSS. Thank you for asking that question.
Sure, thanks.
So Chuck, my next question: what areas other than patient flow can healthcare benefit from workflow tech? And at Z Pewter Guy actually answered it. He said, "We see benefits across HR, IS, and supply chain workflows. All areas are making use of workflow technology, getting away from manual, disconnected, usually paper processes into a truly electronic world." Any other areas you'd add?
Okay, let me, jumping on, cool. Okay, what folks have to understand is that health IT is about a quarter of the way through a fundamental architectural shift. An architecture is sort of how an application is built. And if you go back over the last 3 or 4 decades, a long time ago, everything was all mixed together. Business logic, data, the application didn't talk to anything. And then they took the data out into the database. The database is living outside of the application. Then they eventually started taking out the UI. The user, when you click on a button, that button is not generated by the application. That's generated by the operating system, okay? And so as this happened, the application code became simpler and simpler and less and less. So But what's left right now inside most health IT applications is the workflow code. The workflow code is basically the if-then statements, the case statements in MUMPs, in Java, and there's all these semicolons and brackets, and it's implicit in the code as opposed to explicit and outside of the application. So most industries right now, the description of the workflow, the sequence of steps, and the business rules is actually represented in a database someplace. And as the application runs, just like an expert system in the old days, it consults this representation of workflow. That allows the users to change that representation of workflow outside of the application and change its workflow behavior without having to go back and rewrite and recompile that application. That is going to alleviate so many usability, productivity, safety, and interoperability problems when health IT finally makes this shift from workflow oblivious systems to process aware systems.
Interesting. Max, did you have something you wanted to join us there, or you just missed being on camera?
No, I don't like being on camera. When Chuck was talking, the thing that struck me is that a lot of the software systems that we're working in today, I mean, it's really just a replication of paperwork flow in a electronic format. And so I think there is kind of this, as you're talking about a dynamic shift, I'm really curious about what would happen, if providers said, forget everything you know about paper and how you used to practice medicine on paper. If you want to practice medicine, what are the things that you need and how do you want to do it, and take that paper process out, because we have different technology now.
Relative to paper, the issue is not that we're replicating paper processes. The issue is that once those processes are automated, you can't change them to the way the users want them. If the users want them to replicate the paper process, fine. If the users want to do something different, fine. The problem is the workflow is frozen. It can't be changed after it's implemented. So right now, when people mirror the paper process and the workflow is frozen, they blame the paper process. Well, no, the paper process isn't the problem. The problem is you can't change the workflow to whatever it is that the users want based on whatever workflow analytics or, perhaps more informal, sort of intuitive. Let's keep on tweaking around with this workflow until we push and pull the system into one that is satisfactory.
Excellent. Well, we're up against the clock, unfortunately. So I thought the best way to finish this, since we have HIMSS just around the corner and everyone's going to be there, and that looks like if you're interested in workflow technologies, let's give a shout out to everyone that's going to be at HIMSS. We'll start with ForumFast, and then we'll just rotate through. If you're on video, you can do a video pitch. Where will we find you at HIMSS? What will they find if they come to your booth? And if you don't want to hop on video, put it in the text, and I'll read it off. So let's start with ForumFast. Where can people find you at HIMSS?
All right, we're going to be at booth 4849. We invite you to come by, like I said, and talk to us about your workflow challenges. We have a lot of fun stuff at the booth in addition to our technology, so stop by.
Excellent. All right, Max, is Galen Healthcare going to be at HIMSS?
Absolutely. We're going to be at booth 3273, and I'm going to be live tweeting from education sessions as well. And we're talking a lot about conversions and our new archival product and platform. So a lot more. Just follow me on Twitter and we'll talk.
Yeah, and this is her first HIMSS, so she's a HIMSS virgin. So we're gonna, make her welcomed appropriately. As soon as she goes to that first tweet up and gets her first selfie, she'll be fine. Thanks, Max. We'll see you at HIMSS. Hey, Medicasoft, where are we gonna find you at HIMSS? What will we find?
We will be at booth 11449, and we will be showing both our electronic health record, which does have a workflow engine in it, as well as our personal health record. So we'd love to see you and talk about it. Come by. Drop by and see us.
Excellent. And thanks for joining the conversation. I appreciate it. And we'll be sure to see you at HIMSS. Looks like Mach 7 joined. Looks like their camera's not working. Does your audio work?
Can you hear me?
Yep, we can hear you.
Awesome. Well, I don't know why my video is not working. I did say allow, but anyway, we're going to be in booth 6825. I loved what you said, Chuck, about the litmus test for workflow, being able to configure it and not needing an engineering degree required. And that, I think, is really one of our strengths, our graphical user interface. So love to see you guys stop by and visit us, 6825, and see our enterprise imaging platform, which includes a vendor-neutral archive and workflow communication engine.
Nice, and that's perfect for radiologists. I know Mach 7. I spent some time with you at RSNA, so
yeah, absolutely,
definitely. Does anyone else want to join? Versus Tech is here. I know Kel's still here. You want to tell us where SRS Soft's that? Let's see. Versus Tech wrote live RTS workflow demonstrations, all HIMSS long at booth number 5246. So that's Versus Tech at booth 5246. They also have a cocktail reception Wednesday, 4 to 6 p.m. Come talk to patient flow with us. And thanks for the great chat. Thank you. All right. Anyone else want to tell us where they'll be at HIMSS? I see Roberta here from High Tech Answers. She'll be all over HIMSS, though. So, yeah, there's plenty of others, I'm sure. Chuck, where will we find you at HIMSS?
Everywhere. Basically, I'm probably going to try. I have 107 companies now on my Twitter list. If you go to Wereflow, W-E-R-E-F-L-O, no W at the end, there is a Workflow HIMSS 16 Twitter list. There's 107 members. I'm about 2/3 of the way through the exhibitors. I should get through all of them. That's probably going to be about 140, and then I'm going to I'll sort them into priority. And I will visit the ones Medicasoft I didn't know about, and I was looking at information about their workflow engine. Love it. Mac Tech, Mac 7, love it. Radiology is one of those areas with relatively more advanced workflows. And I'll try to make it around and maybe do my 1-minute interviews in Periscope, maybe a product demo or two, if the connectivity is up to it.
Excellent. Michelle Moore offered one other at QINEC, which I think must be Connect. At Connect, we'll be at MP65 talking about our care, pathway management, and workflow. Looks like she's from across the pond in London.
Yes, and I'd like to mention about Connect. And I've been on their website, and they are applying a kind of longitudinal shared care plan, workflow management. Users can design the workflows. Love it, love it, love it, love it.
Excellent. And Roberta from, I guess now it used to be called High Tech Answers. Sorry, Roberta. I should have said it's Answers Media Company now. She mentioned the Health IT Chicks meetup Tuesday morning. It looks like it's at 10 o'clock. Tuesday mornings, the Health IT Chicks meetup, so you'll find her there. I know they have a whole slew. They have Sue Schwade, who's a hospital CIO. They have Dana Sellers from Encore Health Resources. So that's a great meetup if you want to meet the some of the most talented women in healthcare IT. That's a great meetup as well. All right, well, I guess we'll wrap up and thank everyone for coming. Thanks to Chuck for facilitating this discussion and bringing so many people together. I'm actually hopping off now. I'm doing a webinar in 45 minutes. If you want to join, I think you can still sign up. It's on the HIMSS webinar on actually how to why does no one notice what I'm selling at HIMSS? So we're talking about how to market at HIMSS. So if that's of interest to you, I'll tweet it out on @TechGuy, so you can check that out as well. We'll be doing that webinar, Shahid and I. But thank you, Chuck, for joining us. If you want to see this video, we'll post it on the healthcarescene.com network of websites. Find it on the Healthcare Scene YouTube channel, and we'll certainly do it again. Thanks, Chuck.
Thank you very, very much, John.